It is noon, and it's time for our Friday Lunch and Learn. And I have a report here, and it is written by a medical doctor, and his name is Dr. William Supple, okay? And he works, he's got his doctorate in neuroscience from Dartmouth College, okay? And he's talking about how to avoid the second wave of this COVID-19 thing. So I know that here in our state, we live in the great state of Texas, and we're being able to do more and more things. And that even pains me to say that because, America is a free country and we should not be given permission to do our work and that kind of thing, but this is where we are. And so I don't want to get sidetracked on that. But I do think it is important as we are out and about doing what we love to do that we protect ourselves against a second wave that the experts tell us will probably come in the fall. Now, this doctor says that it is possible to prevent a second wave. And so this is what we want to do. We want to be able to be healthy. We want to be able to, as we are out and about doing what we're doing, we want to keep our immune system strong. So in the fall, if this kind of rears its ugly head again, we are prepared and our immune system knows what to do, okay? So those are some things that we want to talk about. So he says maintaining an adequate vitamin D level will fuel an effective immune response, and it can be just as simple as getting some sunshine. Now, it just depends on where you live. I'm going to get a little geeky here with this report because I need to get the globe out and see where our latitude and longitude is, okay, see where we are in this. But this is what this doctor says. He says, what environmental factor varies with the seasons and affects our biology to such an extent that it influences our susceptibility to viral infections, okay? The answer is sunshine, of course, and more accurately, the seasonal production of vitamin D. Now, we all know that vitamin D is a sunshine vitamin, but what we don't know is that we have to be exposed to the sunshine for at least 15 minutes. Now, the report says that if you are exposed to the sunshine for at least 15 minutes, that you can produce as much as 10,000 international units of vitamin D. Now, if you are older, and we're going to get to this in the report, then your skin is not as effective in converting that sunshine to vitamin D. And if you are darker skinned, if you have more melanin in your skin, you need to have twice as long of an exposure to produce the vitamin D that you need. Now, this is one of my pet peeves as a clinician. I will ask people who sit across, just like you're sitting across from me right now, I will ask them for their blood work. And most of the time, if they have blood work at all, when they bring in their blood work, they do not have any vitamin D on the blood work. And the medical doctors don't think that vitamin D is important, and so they don't usually order a vitamin D panel on the blood work. And so I always ask, when somebody asks me what kind of blood work do I want to see your CBC, I want to see your metabolic panel, I want to see your thyroid panel, and I want to see your vitamin D, because to me, your vitamin D is really, really indicative of how your immune system is functioning. Some people say that vitamin D acts more like a hormone than a vitamin. Don't want to debate that here right now, but what I do want to say is vitamin D is very, very important. On your reference range in your blood work, your reference range is going to say if you are 30 to 100, then you're doing well, and that's nanograms per deciliter. In holistic land, we want you to be above 60. We know that when you are above 60, you're going to be able to prevent yourself from getting viral infections. You're going to be able to prevent yourself from getting cancers, and you're also going to prevent yourself from being depressed. And so we want to see that vitamin D level high. So I want you to really insist with your doctor that you get that vitamin D level checked, because it's very, very important to the overall health, as this report is going to tell us, okay? It says, well known for its role in building and maintaining strong bones, vitamin D is also essential to the proper functioning of the immune system. The immune system is tasked with identifying and eliminating cells invading the body that can make us sick. Without adequate levels of vitamin D, the immune system cannot differentiate disease-causing cells from healthy cells. So this is a problem with autoimmune disease. That's what an autoimmune disease is. Your body does not know the difference between an invader and self. So if you are out there and you are suffering with an autoimmune disease, you want to get your vitamin D levels checked. You want to make sure that you are taking adequate vitamin D, okay? The result is a dysfunctional immune system invading the cells that cause sickness, go undetected, and healthy cells are mistakenly attacked, okay? The average adult uses about 4,000 international units of vitamin D per day. Okay, that's what you use. The CDC, or the recommended daily adult requirement, is only 400 IUs a day. If you use up 4,000 and you're only putting in 400, you're going to be woefully inadequate, okay? So in holistic world, all right, and we do it differently, we want you to take, on average, we want you to take 9,000 IUs a day. Now, you may go to the doctor, and the doctor will give you a vitamin D prescription. Now, a lot of times that will be a 50,000 IU capsule, and you're going to take it once a week. That's usually what they recommend. Now, this is what we feel is wrong with that. Number one, when you take vitamin D, you need to take a lot. That's why it's 50,000. It goes orally. It's a pill. It goes through digestion. It goes through the stomach, hydrochloric acid and all that kind of stuff. And a lot of the vitamin D is used up or contaminated or destroyed with the stomach acid. Then it makes the first pass through the liver, okay? The liver also contaminates and destroys some vitamin D. The vitamin D, though, goes into the kidneys, where actually it is absorbed and does what it needs to do in the body. So by the time it gets through the hydrochloric acid and it gets through the liver, there's very, very little going through the kidney to get to the bloodstream. So what we recommend is a product that is a liposomic spray. It goes right into the cheek, and each spray is 1,000 IUs, and we want you to do about 9,000 or 9 sprays per day. That way you get 9,000 IUs. So if you use 4,000, that gives you an extra 5,000 buffer, okay? Now, we have seen clinically that when people come in with their blood work and they're very low on their vitamin D, that if they will use this spray continually for 60 days, it will double wherever you are. So we've seen this happen clinically. I will just tell you, this girl used to be out in the sun all the time, and I never would have thought that I would have a vitamin D deficiency, but I had my blood work done probably about 10 years ago, and my vitamin D level was 18, okay? 18. And so that is woefully inadequate. And so I began taking vitamin D supplements, and I take it every day. And my last blood work, which was about 6 months ago, showed that my vitamin D level was like 82. So I'm well within the range of health, and I'm going to have whatever I need to take care of myself. And so if you have an adequate vitamin D level, then this is a really good thing for your immune system, and that's what we need to know. So it goes on, this is where the geeky part comes, okay? A normal diet contributes next to nothing to vitamin D production, okay? The answer is getting sunlight in the summer months to store for the winter months, okay? So it sounds kind of like we're little squirrels here with our little vitamin D here. There is virtually no solar-generated vitamin D in the skin from the sun for the vast majority of the United States. Anything greater than 37 degrees latitude. So we all are going to have to get out the globe, and are we going to Google where are we on the latitude scale. So if you are higher than 37 degrees latitude from November to March, you're not getting any vitamin D from the sun due to the degree or the angle which the earth is relative to the sun, sending the rays through the ozone layer. The ozone layer absorbs more of the the ultraviolet protons, okay? So due to the use of sunscreen and an indoor lifestyle, most Americans do not generate enough vitamin D during the summer months, so they are severely deficient by the time that winter comes around. Now, I just told you that mine is at 82, which is a really, really strong vitamin D. And I have not had a viral infection in many, many years. Probably, I would say 40 years or more. I cannot remember being sick with a viral infection. So even at 18, woeful 18, I still wasn't sick. But I don't want to be at 18. I want to be at 80 to 100 because I really want to protect myself. Cancer is in both of my parents, and both of them are survivors, so thank God for that. But that means that I have broken genes in my DNA, and if I don't take care of myself, then I'm going to be more subject to those diseases, and I don't want to do that. So a lack of vitamin D causes inflammatory diseases, okay? It causes an inflammatory response. All right, so these are the diseases that are produced from an inflammatory response, okay? So you've got all of your autoimmune diseases there, okay? You've got arthritis, atherosclerosis, type 1 diabetes, multiple sclerosis, psoriasis, Crohn's disease, okay, and ulcerative colitis. So that's a lot, all right? Those are a lot of those diseases. Other factors can contribute to this, okay? Some people who are deficient in vitamin D are also more likely to develop cardiovascular disease and cancers of the epithelial origin. So that would be breast, prostate, colon, and lung. So how much breast cancer could we avert if our vitamin D levels were adequate? I mean, that's a very legitimate question. And so this is why I don't understand why your medical doctors do not have any kind of importance attached to vitamin D levels, because cancer is rampant in our society. I think if you are a man, I think your odds are 2 in 3 have cancer, and as a woman, it's 1 in 3. I think that's right. I might have that flipped. It's been a little while since I saw those statistics. But anyway, you are 1/3 at least susceptible to cancer. So we all need to do what we need to do in order to avoid that. And so having a high vitamin D level is very, very important. And vitamin D is not that expensive, guys. I think it's like 300 sprays for, I think it's $52 or something like that. So once you get your levels up, you don't have to take that much per day. But what an investment in your health to be able to get that vitamin D up, okay? So it says many studies have confirmed that living in a northern climate and its lack of vitamin D is a risk factor for developing these maladies. Being chronically deficient in vitamin D causes immune dysfunction, resulting in chronic inflammation, okay? So we're going to talk about COVID-19 and pre-existing conditions and vitamin D. Why are we doing this? Because we want to be ready for the next wave, should the next wave come, okay? And I just love how my light behind me is giving me a little halo effect. I feel very angelic right now. All right. It says the current wave of COVID-19 hits with diseases listed above, plus the elderly and the African Americans the hardest. Now, we've seen this in the statistics, that if you're older, and I just love this, elderly starts at 63 now, and it's like, what? I don't feel elderly. And also the African American community is being hit hardest. So what we want to do is we want to hear about why is that? Why is that? Well, the elderly are typically severely vitamin D deficient because older skin is much less effective at producing the sunlight-generated vitamin D compared to younger skin. So if we're older, we need to spend more time in the sun. Take precautions right? Don't put on sunscreen because that defeats the purpose, right? But be careful. You don't want to be out in the very, very hot sun where the rays are the strongest, right? You want to be careful not to get burned, but you also need to stay out there long enough that you get enough vitamin D that you can store it, okay? Vitamin D is a fat-soluble vitamin, so you will store it. It says, likewise, darker skin, due to the increased UVB absorbing melanin content, produces less vitamin D as well, leading to a greater vitamin D deficiency among the African Americans. Since vitamin D deficiency is related to the incidence of these diseases, it's no wonder that the older people and the African Americans with any of these conditions don't do well with COVID-19, okay? To make these matters worse for these groups of people, there are also more likely to be taking therapeutic drugs that specifically suppress a component of their immune system in an effort to treat the symptoms of their specific disease. Okay, so an elderly African-American man is taking an immunosuppressant biologic drug to treat a condition like psoriasis, has less chance of defending himself against COVID-19. So this is all really, really important. And remember, we've talked about in our videos, we've talked about comorbidities, right? That this COVID-19 is worse if you have comorbidities. And the comorbidities are obesity, heart disease, COPD, and diabetes, okay? And that's what this article is talking about. So if your immune system is already compromised, and if you're already taking an immune suppressant drug, and why would you do that? Well, if your immune system is attacking your body with an autoimmune disease, the doctors want to quieten, depress your immune system so it doesn't fight against your body. I understand the logic, but it bites you when you then come against a sickness or a viral infection or whatever, and your immune system has been weakened therapeutically. You don't have what it takes in order to fight that disease. That's why the African American community and the elderly are having such a hard time. Most of the people who are in nursing homes are elderly, of course, but they're also very infirm. If you look at older people, both of my parents are in their 80s and they're both still at home. Thank God, they're well enough to do that. If they were ill, if they could not be cared for in the home, right, they would be, hopefully not, but that's why people are in the nursing homes, because they need 24-hour nursing care because their immune system has been compromised to such an extent that they just can't function anymore. And so those are the kind of things that make this disease more difficult in that population, because they have those comorbidities. So if we can keep our vitamin D up, right, we're going to be less susceptible if the virus should come around again, okay? So, continuing with this report, all right? The immune storm, now you might have heard of the cytokine storm, all right? Don't want to go into all the details of that because I don't have that much time on the video, okay? But we're going to say that the inflammation with this virus produces this cytokine storm, okay? It says, the immune storm that does the killing with COVID-19 reflects an immune system gone haywire, all right? Pro-inflammatory cytokines, substances like interferons and interleukins secreted by the immune cells, are released inappropriately and destructively, causing fluid in the lungs to build up, essentially drowning the victim, okay? COVID-19 hijacks the immune system, and if that immune system is impaired or dysfunctional to begin with due to chronic vitamin D deficiency, then the outcome is not good. And so those are the kind of the things that a naturopath is going to look at cause and effect, okay? I'm going to, when we do our evaluation here, we can assess the immune system. We can see where its vibrational level is. Okay, we can see, is it functioning where it needs to be, or is it suppressed? If it's suppressed, that means it's weakened. It's not going to have the strength that it needs to come against this new invader. And so these are some of the kind of things that we do here at the clinic. We do it with our EAV technology with an appointment, but we also have this new technology that we can take just 4 strands of your hair. Of course, we have to pull it out by the roots, all right? And we scan that into a database at a medical lab in Germany, and they will do an assessment of where your immunity is. Is this something that is a real worry for you? Is this something that you really need to attend to? Or are you functioning on all cylinders and you can take whatever life throws at you? So these are some really good tools that we have. And if we can use these tools to see where you are, then we can shore you up before the fall, before this second wave. And so I just want you to think about that. Number 1, look at your blood work. Do you have a vitamin D level? And number 2, come on in. It takes 5 minutes of your time. Give me 4 of your hairs. It doesn't hurt that much, okay? We take tweezers and we're really, really fast. It doesn't take that much time. It's not that expensive to get this done, and it gives you 2 distinct specific measurements. Number 1, where is your immune system and how is it doing? And number 2, your gut health. What's going on in the gut? They say that your gut is your second immune system. So if your gut is messed up, then you're not going to have a good immune response. And so this report is very, very good, and it's going to give you those 2 key indicators, okay? So that's just something that we have here. We want you to take advantage of, all right? So a lot of people, especially my older people, are all wigged out here because they remember their parents or their grandparents telling them about the previous pandemics, and so they've got that fear mentality because of collective consciousness, for lack of other words. Anyway, they have this fear that this flu, okay, is going to be as bad as the Spanish flu was. I think it was in 1918, okay? So we're going to talk about that a little bit. All right, so using the Spanish flu pandemic as a model, okay, in 1918, the second wave of the flu was 5 times deadlier than the first wave, all right? So this is why people are concerned, because we have a past history, okay? So it says that the real numbers, according to the CDC figures, the peak rate in late June of 1918 was around 5 per 1,000 persons. In early November of 1918, it was 25 per 1,000, so it was a whole lot worse on the second wave, okay? That's the bad news, but the good news is that there is something that we can all do to help protect ourselves from the second wave, okay? It's easy, and it's cheap, and it's safe, okay? So we want to make sure that we do that. It says consult with your doctor, find out what your vitamin D level is, and get it tested, okay? If you are vitamin D deficient, getting sunlight is a problem. We can supplement. Now, where we live in South Texas, you can always go out and get your fill of the sunshine. So from now until September, I definitely would go out every day for at least 15 minutes a day. Get that sunshine. Soak it up. I take the spray, the Sol Ray D. I take that every day. I do probably 9 to 12 sprays a day. Why is that? Because it is good on so many levels, and it does so many good things for me. And I want to be protected against viral invasions. I want to get protected against cancer. I want to get protected against all those kind of things. So it's really, really, really important that we do that. And like I said, it's not all that expensive. Going out in the sunshine is $0. All right, doing the Sol Ray D spray, I think, like I said, I think it's $50. I think my bottle lasts me a couple of months. So really, that's a very, very small investment. Somebody says, if you color your hair, can you do this? Yes. We're not testing this part. We're testing the root part. And so as the root comes out, it has your DNA in it, and that's kind of what we're looking at. So colored hair is not a problem. So you want to come in and do that. Tracy, my assistant, does that. Barbara, I think, can do that as well. So if I'm back here in my office with the patients that I see every day, I may not be available, but just call the office and just say, I want to come in and do that DNA hair thing. You're going to get a really big report. I think it's like 38 pages, and it tells you what nutritional deficits do you have. So it's going to tell you the two things. It's going to tell you what is the state of my immune system, and it rates it on you're good, don't have to worry about it, or you're kind of so-so, we need to do a little bit, or man, you're really not doing too good, we need to do all these other things, okay? It also tells you the state of your gut health. Where are you? And again, I'm good, minimal, maintenance needed, or I'm a little on the sketchy side, we need to do a little bit more, or holy moly, I'm not doing very well at all, so I need to have a real good overhaul. Now, we do have a lot of things. If you already know you have gut issues, right? 80% of your immune system is in your gut. So if you already know you have gut issues, you want to come by. Don't spend money for the appointment, okay? You want to do a protocol called Thrive in 63. It's a 63-day protocol. It is very food intensive. There's an avoid list, and there are supplements, but it will absolutely clean up your gut in 63 days. So this is a really good jump start if you already know that you have gut issues. Now, how will you know? You will know if you have a lot of gas, if you have a lot of diarrhea, constipation, if you have a lot of bloating, you know that you've got gut issues. So we want to take advantage of the tools that we have so that we can take care of that. If you get your gut right, if you get your vitamin D level high, you're not going to have to worry and take, Herculean measures in order to keep yourself healthy, right? Your body wants to be healthy. Your immune system has everything it needs to keep you healthy. What we find is that the American diet, with all of its carbs, and I saw a video this morning, I was doing some training this morning, and I saw a video that said if we are doing the high carb diet, then what that's doing to the gut is messing up our immune system, and we're going to be far more likely to come down with sickness and disease. So we don't want to do that, right? So we've got these tools for you. Don't be afraid. I did a blog yesterday. I did a blog yesterday on the controversy about wearing a mask. Should you not? So check that out. Remember also, we've got the Corona Essential Oil Blend for you when you go back out into the public. And I do want you to go back in the public. I've been talking to a girlfriend, and I think I'm going to meet up with her tomorrow, and we're going to have hugs in real life. And so you want to make sure that as you go out and take care of yourself, and all of that is self-care, right? As you go out and take care of yourself, you also want to have protection if you're afraid. Okay, I'm not afraid, but if you are afraid, then you want to do what you can do in order to re-enter society with the best possible defenses. So we've got that essential oil blend that gives you a little force field that wards off any kind of viral penetration there. So we have these things for you. I hope you have found this beneficial. If you have any questions, let us know. If you want to come by and take advantage of that hair DNA analysis, like I say, you don't need an appointment with me, but you do want to call and just kind of set up a time to make sure that somebody at the front desk knows how to do that. It doesn't take very long, and I think you'll be happy with the results. So take care of yourself. It's the weekend. Yay. Go get some vitamin D. Take care of your immune system, and don't be afraid. Okay? See you next week. Bye-bye.